Okay, so here we've got something that we don't actually see every day in England. It's this little donkey with tetanus. Fortunately, we're lucky enough to be able to vaccinate our horses and donkeys in England against it, but other people out here can't afford it, so we do see it quite frequently. It's caused by a bacteria that is often in the soil and finds points of entry through wounds, grazes, cuts, puncture wounds, things like that. With this donkey, he came in a week ago. They didn't actually find a wound at first. Often that's the case, they heal up before you actually see the tetanus occurring. You can see he's actually got a mild case of his lockjaw. He's sort of very stiff. His muscles are kind of they're contracted, so he can't sort of relax. And you can see he's got a very stiff leg. He's all very stiff. And you push him, his gait's not very free. When you see him eating, he eats very, very slowly, again because all his muscles are just so tensed up because of the toxin. At the moment, obviously you can see he's got cotton wool in his ears, he's got a face mask on to try and provide the least amount of excitement and keep him nice and calm. And here he's got an intravenous catheter, so we can give him really high doses of penicillin, which kills any bacteria that's in the system. He's also had tetanus antitoxin for a couple of days, and he is showing some improvement, so good time. The next case that we'll have a look at is a little donkey who's in pretty good condition, but he's come in, he's got a caustic burn on his tail base, which isn't very nice. This is most likely caused by when he's been pulling this cart, there's been something, he's been pulling either hot tar or acid or something that's fallen off and caused this horrible burn to dribble down the backs of his legs. You can see along here there's some nice healthy tissue coming through, but obviously there's still quite a lot of work to be done. We can't close it up, so we're just treating it as an open wound. We've actually been putting some Vetericyn spray on it because we think that this might do the trick for this sort of wound, but we'll see how it goes. And then Pat is going to show you something that we found this morning, quite an interesting case.
There was an old horse that came in with a wound on its tendon that you saw Laura stitching up in the last video. It actually got colic last night, and it was colicking quite badly this morning. It had all the painkillers that we'd normally give a horse, but the pain was so severe that we had to put her to sleep in the end. But coming closer, this is a post-mortem. You can see this is a classic case of a plastic bag colic. These animals are left out on the rubbish tip to eat, and they're not fed properly, and you can see the damage to the inside of the small colon that this foreign body has done. So this was a colic that wasn't going to get better. The guts were all twisted up in the rope, and sadly that's something that can be prevented by feeding them and keeping them off rubbish dumps.